The Ghana Neglected Tropical Diseases Master Plan for 2021 to 2025 highlights the Eastern region as a significant area burdened by neglected tropical diseases. Many districts in this region face the dual challenge of skin NTDs and inadequate access to safe water and sanitation. The expanded special project for the elimination of neglected tropical diseases has identified 13 out of the 33 districts within the Eastern region as high priority zones for investment. The Eastern region has consistently reported cases of Buruli ulcer, with nearly 6,000 suspected cases documented since 2010. Additionally, leprosy, elephantiasis, yaws, and scabies are among the skin NTDs prevalent in the area.
The neglect in neglected tropical diseases, it's very telling. Some of the images, stories, and the severity of cases we identify in the communities, it's evident that these cases have been there for long, and so there is the need for communities to seek treatment and then early diagnosis.
I shall see an name honor, my nan has a postal home. I yet send me a shoe and a pie. Nami ye fool, minya bro, banching. Eti me to be beton. Didi, and so science I may now intino. Say me so a formanico, Yaji, I don't for.
Now, a doctor for Eba me ho. One more buy no, and one more can say, membrana, omo and coffee, me nine. And I'm catch one say, may ye as only for be a drew. Intino, one more catching your woman with me quite almost say, and yet a drew different beer and count. And Sana may catch it, papa. And my papa no call. I feel the me here saying I didn't call none ordin. Intimate Madam Susie on a miss one friend NGO for no and mammy, one better me. I said, me, drone now, also for a drone and cock and cock. Internet, I said, I had a bed Jimmy, it's in a mammy by.
In February 2023, Hope for Future Generations and Rural Watch, with technical support from the Ghana Health Service, launched a transformative project dubbed Strengthening Community Systems to Scale Up Community-Led Response Interventions to End Neglected Tropical Diseases in the Eastern region. This two-year project targets 10 districts for implementation. They include Okre, Esujaman, Lower Manyakrobo, Kwewu West, Denchembuo, Brim North, and Brim South. The remaining districts include Achiase, Achimansa, and Kwaibi Brim. Funded by Anesvad, the project aligns with Ghana's national health policy and is making significant steps toward combating neglected tropical diseases in the region.
HFG has been working in 10 districts in the Eastern region. The Eastern region also happens to be a place where we have a number of intervention districts. And so a number of times we've come across some of the individuals that your interventions are reaching. We've seen the palpable effects of whatever you are giving them, the self-care items, the training these individuals to be able to do something to improve their living conditions and all that. And you can see that you're making that positive impact in the lives. So one life touch here, one life touch here, a whole lot of people touch, a whole community being impacted. And we see that. And, you know, with the health system, we can only do so much, right? And so when we have another NGO in that space, and we like the way you are using strategies that we are also using. So you're complementing whatever we are doing and enabling our work to go further. Like I said, we're in a few districts. You're also working in some districts. So when you take Eastern region, so many districts are being touched with interventions. And we can only thank HFG for helping in that regard.
In fact, I want to say kudos to Hope for Future for adding Eastern Region to their project. 10 district is not a small one. I think we need to appreciate the donors, Anesvad, for the good work that they have done. We also pray that we continue putting our small resources that we also have to support them to reach the unreached people.
Through this project, Hope for Future Generations is driving impactful change by promoting the early detection and management of skin NTDs to bridge the inequalities in access to health care. One key intervention is the distribution of self-care wound dressing kits, which is empowering individuals affected by Brûlé ulcer and elephantiasis to dress their wounds daily at no cost. This approach not only improves care but also restores dignity and hope to those most affected.
Civil society continuously mobilize these community members, these beneficiaries. It is something that the government has to work with civil society, communities, and families. Early detection is very important, and we all know that cases that are people that are detected early of leprosy, Brûlé ulcer, and elephantiasis, the signs can be treated. And so the government needs to invest, work hand in hand with the community traditional leaders, civil society communities, families, to ensure that cases are confirmed early, treatment and resources are available for Ghana Health Service staff to get to the communities and the villages to support and treat them early. Secondly, National Health Insurance needs to ensure that people have access to the card so that they can access quality health service at their doorsteps. So this is it. Community members have to address stigma so that people can come out. Psychosocial support is very necessary for people who are affected because most of them end up being isolated by their families. So we need to all come together to address this and ensure that we mobilize resources for this.
Tell me, what do you remember about yourself?
I remember that when I am 5 years, my mother took me out to Kolebu Teaching Hospital.
And then what happened? Any other thing you remember?
I don't remember
Okay.
it.
So from that 5 years, you have had to live with a swollen leg, right?
Yes.
And does it get bigger than this?
Sometimes.
Sometimes it gets bigger than this.
Yes.
So do you go to school?
Yes.
How do you take this to school?
I wear trousers.
The school allows you to wear trousers.
Yes.
Do you get them calling you any names?
Sometimes.
What names?
My one leg is bigger than the other one is small.
So the name they call you in the local language, what do they say?
As a man, back to Timba.
Unai bako susine bako, which means one leg is bigger than the other. Okay, but how do you feel as a person not having a normal sized leg like your colleagues?
Very sad.
Menai bɛyɛ mmea ɛma ɛyɛ kɛseɛ menum deɛ nti a ɛbaa ne saa nti maame de me kyi yaa kɔ ne nam baabiaa so na ɛkɔ so ɛtumi yɛ hyehyɛhyɛ na kɛseɛ no bi abɛka ho nti ɔmo kyerɛkyerɛ baabi bebree ma yɛde kɔɔyɛ nso anyɛ yie na mmoa no mewɔ hɔ no mete sɛ doctors bi ba ha sɛ mɔbɛhwehwɛ saa yareɛ no ɔmama yɛ ho aduro ɔmo yɛ HFFG4 ɔmo ba asuo mu na ɔmo bɛkyerɛkyerɛ kwan yɛbɛfa so a ma yɛ nan no mu ayɛ ha so ɔmo bɛkyerɛ me sɛnea mɛyɛ no ɔmo ma me rɔba a mede bɛhohoro so ne tawa mede bɛpepa ho fine nti meyɛɛ no ɛnɛ nyame adom emu ayɛ ha ma me hyehyɛhyɛ no so a na ɛyɛ me no a ɛma ne ba saa no ɛno so agyae ne yɛ na ɛyɛ me yɛ no so no ɛmba saa bio
ɛna benkum wɔ problem na ɛho a na hyɛ nsuo I'm the doctor bi or from HFFG. Omni me bedi nkomo e ma me akwankyere. Se me sori me dware wi a me fensu onyu hohoro so. Me di sa instruction om de ma me achi ni. Me na nene me ka hye nyame anuonyam se ho ebi.
Me da me nuanom doctor for ya se HIG for ya se pa. So ma do ma bo ame. Na me hia won mreti a wa bi ni. Na me nan enya sam keto akra so me hia won no. Ena nkunimdie ya ya media. Ti me da o ma se pa nyame hira won.
Me yale we started 2019. They are hospital akwa bi no so say atume do na honkeka wa ma ya nko anti mbeshia hope for future generation 2024 ya be bosum enuma na say bosum na na o start say o mo bra me nduro so they say me kasa de ekro na ba foma aka ketekete kura me di say na so o ma se bra me nduro a me de to so a but next time me ba no na yale ne nyina ekro ne nyina adan ewu anti me tumi nuanum fo say ba na say say yale we bi ba so a ama obi medada on kan chiro say bia obi na atu aduro say me da hope of future generation ase what the omayama ye no omo nkoso amu aye ne a yewo yale we no bi.
People still hold on the fact that if you have these cases or you are afflicted with this condition, means that you are cursed. Somebody is doing you. That is a Ghanaian language. Somebody is doing you, and so we need to do more in terms of educating the public and then the client themselves, because some of them have sores in addition to the swelling and other things. So if their mind is not trained to the fact that it's a disease, healing process is very difficult. So we think that with more of the health educations and community engagement is very important.
In just 2 years of implementation, Hope for Future Generations, in partnership with Rural Watch, have achieved remarkable milestones. These include identifying over 1,300 suspected cases of NTDs and also reaching 31,000 people through community sensitizations and behavior change communication initiatives designed to combat poor sanitation, stigma, and discrimination. Additionally, 20 school health clubs were sensitized on NTDs, reaching over 1,000 students. These accomplishments are a testament to the power of collaboration made possible by the unwavering support of key stakeholders, including the Ghana Health Service, the Environmental Health and Sanitation Department, the School Health Education Program, and the dedication of our community health volunteers and traditional leaders.
If these people are really seen as part of us, we will not isolate them. So we have to ensure that stigma is addressed. Now, you can only eliminate disease if you have workable strategies, and we need to look at the strategies for elimination. It's a process. We cannot start one day and eliminate. We need to ensure that district assemblies, which is government representative at that level, play a key role. We need to provide potable water to these people. We need to ensure that hygiene is something that can be accessible. We need to ensure that people are aware of the mode of transmission of neglected tropical diseases and prevent it. And we need resources to treat people who have signs and symptoms so that they don't get into deformity and bigger problems that government has to invest more money in addressing.
A lot has been achieved as far as the project is concerned. The community systems have actually been engaged in terms of the volunteers, the traditional leaders, and then link up with the health system, the health facilities that are working. So we are hoping that we can get additional funding for scale up that we can work in this year. Because this disease actually causes poverty, stigma, as we have seen, as we discussed, and exclusion from the society. So our capacity and ability to engage communities, to strengthen community systems, enable the community support for people who are suffering from these diseases, and for them to be cured.
Anytime you're doing any intervention, you have to think sustainability, right? The NGO is not going to be there all the time. Anesvad may not be there all the time. But the government is there all the time. These are citizens of Ghana. They need to be able to benefit from whatever resources we have as a collective. What are the potential sources? Some like the NHIS. Can we expand the coverage to make sure that these individuals who we say are living in conditions of poverty are being affected by conditions that will predispose and perpetuate the cycle of poverty? How do we link them up and make sure that NHIS can work for them? That kind of advocacy is something that we need to look at. I know the programs are already doing that, and the support of HFG in that, so that we complement our efforts to make sure such openings can come for NTDs will be very, very welcome.
People affected by neglected tropical diseases are mostly at the hard-to-reach areas. It is important that government invest adequately in addressing and treating neglected tropical diseases in Ghana and work in partnership with civil society, community members, Ghana Health Service at different levels, and even policy makers, especially parliamentarians, who are members of the constituency and where these diseases are all over.